Dr. Vanita.
Hi, how are you doing?
I'm doing great. How are you?
Good.
Thank you. So, Dr. Vanita, could you tell us something about yourself? Could you introduce yourself to our audience?
Well, I am a cardiologist, a female cardiologist, as you know, and I have a very rare branch and a very special branch in which I specialize, that is cardiac electrophysiology.
Okay.
It deals with the heartbeats. I deal with the slower heartbeats, I deal with faster heartbeats, and I take care of patients who have heart failure. I put in devices, I do radio frequency ablations to make them feel better from the heartbeat problems.
Okay. So, you were always passionate towards your field?
Well,
Like how
it's
did
a
this
very
come?
difficult question to answer.
Okay.
I always knew I wanted to be a doctor because I belong to a family of doctors.
Okay.
My father is a doctor, both my brothers are doctors, one of my sister-in-law is also a doctor. So I always knew I have to be a doctor because I was the eldest child in the house. But whether I am going to be a cardiologist and over and above that cardiac electrophysiologist, that has happened with default.
Okay.
Because I did MD internal medicine out of passion because I was very fond of that subject, and after finishing my MD I didn't know which specialty to take further. So I joined Escorts Heart Institute after finishing my MD, and I developed an interest in cardiology. My teacher there, Professor M.L. Bhatia, who has been an HOD of All India Institute of Medical Sciences for 19 years. He persuaded me and convinced me into cardiology. I loved the branch. I did my DMB in cardiology from Escorts, and while doing my DMB only, I developed an interest in cardiac electrophysiology. Not many people venture into cardiac electrophysiologists. You know who are cardiologists. You know about angioplasty. You know about stent. But how many times have you heard about a term called cardiac electrophysiology?
Yes. I have heard it for the first time.
Right. So it's a very rare branch. It is a difficult branch. That is why very few people venture into it.
Okay.
It is very challenging. It is demanding, and you require brains for that.
Definitely.
So that's why, and I have always been. It's been my passion to be up against challenges.
Okay.
Whenever I hear somebody saying this is not possible, I have to do that.
You have to do that.
Yes, because I believe even impossible says I am possible.
Okay. So you believe in that philosophy?
Absolutely, absolutely.
Okay. Dr. Vanita, you have 22 years of experience in your field, which is not a small figure. So share something about your experience into your field.
Positive or negative?
Positive and negative both.
22 years gone by. Well, it's been an interesting journey.
Okay.
I wouldn't say it has been without hurdles, but all I can say is it's a difficult field for a female, a single female, to survive still in any kind of such branch in our country, and it's not been a smooth sailing. I've had people create hindrances right from the beginning just because I'm a female, and more hindrances because I'm a female with brains. So that's been a difficult situation. However, once you are across that, you just don't have to look back and just with confidence move forward. That's the most important thing which matters in life.
Okay.
I give an example that when people throw stones on you, either you can get hurt by them or you can pile them up, make a mountain and start climbing it. And that's your way to success. That's what I've done.
Okay. So you have faced things like in this field, something like males are dominating in it.
There has been not only a dominance, there has been a lot of bias.
Okay.
For me to be a female, there's been a lot of bias, yes.
Okay.
It still is.
It's interesting that in
still
spite
is.
of all those hurdles in your life, you stand up here with so much. Okay. Dr. Vanita, a lot of people suffer through heart problems these days. A lot of them are suffering. So we want to know what heart, there is a few misconceptions as well. So we want to know that what heart failure exactly is and what causes it.
You see the term heart failure. Heart is cardiac, right? Failure means it is not functioning properly. It has gone into failure.
Okay.
It is not doing its function properly. You see, heart starts to beat while a child is in a fetal condition inside the womb of the mother. It starts to beat that early, right? And it beats till the person expires, right? The heart is the only organ which is working constantly day in and day out, 24/7, right? Now you would say, why doesn't it get tired? It doesn't get tired because once the heart is contracting, it's called systole, it's contracting, that is the time it is working, and when it is, there is a relaxation after that, that is known as diastole. That is the time when the heart is relaxing, so it takes its time off. Okay. Now with this systole and diastole going on, whenever the systole function becomes compromised, the muscle of the heart becomes weak because of either heart attack or the muscle has some infection or some kind of a infiltration disease because of which it is not contracting properly. Then patient starts to have symptoms of heart failure. Okay. Now what happens is, it is very commonly known that patient had a heart attack, he went to the hospital, they did there was an attack, they did angiography, they did angioplasty, and the vessel has been restored with the blood flow because angioplasty has been done. However, the patient is never told that there are after effects of that also. Once the patient has had a heart attack, the damage is done. They have to take care of the heart muscle to not let them have a damage further ahead. However, it is either because of ignorance or because of unawareness that patient doesn't care about that. The most important thing for patient is to know their ejection fraction, which is calculated by echo. Echo does the heart functioning calculation. It shows us how good the heart is functioning, whether it is contracting or systolic performance is good or not, or it is relaxing normally or not. So if there is a fall in this heart ejection fraction, then the patient will have symptoms of heart failure. And that is the most difficult situation because the muscle has been damaged. And the heart is not contracting right. That is what I do, that is what I correct. That is one part of my job.
So what causes it?
You can have it because of blockages in the arteries. There has been a heart attack, it can be because of that. It can be because of your blood pressure problem. You had blood pressure which is totally uncontrolled, you kept it uncontrolled for years together, not taken care of it, that's why you can have the heart, the load on the heart is so much that it starts to fail. Uncontrolled diabetes can do this. If you have diabetes, there is a constant damage on the heart that can affect the heart muscle directly. It can become, sometimes in pregnancy it can happen that heart muscle can get affected. Certain viral infections can do that. It's known as myocarditis. So certain viral infections can do that. And then there are some valvular problems which can occur because of infections of the valves, which can lead out to heart function failure.
So what you are saying is, the people like uncontrolled blood pressure, hypertension problems and uncontrolled diabetes can lead to heart failure.
Yes.
So if a person is not on regular medicines to cure blood pressure or diabetes.
Not only medication but rest of the precautions also. Yes. This can all cause effect on the heart and lead on to heart failure. Yeah.
These days even kids come across problems like low BP, low blood pressure or high blood pressure, diabetes problems. So why does it happen in kids? Is it in the genes? Is it because of the genes, or there's any specific reason that children are doing out there and they should avoid?
In children, it is genetic. It does happen because of genetics. Secondly, it happens because of the stress, that amount of stress that they have. Thirdly, most of our female families I have seen, the Indian families I have seen, that females while they are pregnant, they don't undergo a regular antenatal checkup. they come across. We have, you see, urbanization of our living is there. We have females who are career oriented. They get pregnant. They keep on working. Then they don't take care of their health so good as they should, right? Once you are bearing a child, you know, you are supposed to be extra careful about what you are eating, what your hygiene is, where you are, how you are working, how are you are traveling, you know, how much stress you are carrying through that. And neither do they undergo antenatal checkup. So they are up against a lot of infections. So, and infections during pregnancy can cause these problems in the children further.
All right.
Right? So it is very important for us to take care of the female health as an issue. We should make it an issue, you know, in our country. We should take care of females so that our next progeny is better, you know.
Okay. Yes, so that is what happens. Females these days are so ambitious that during their pregnancy time also
they should be ambitious.
They should be ambitious, but over ambitious. They have to work, you know, both the people have to work. That is what happens in our society. They avoid taking care of, like, even if you take our examples, you know, we would still want to work. We get used to it.
See, I am not against females being ambitious or over ambitious. I am against them not taking care of themselves. Or I am against their families or their husbands not taking good care of themselves. You know, they are supposed to take care of themselves. That is the most important thing.
Okay. Dr. Vanita, what is CRT? That is cardiac
resynchronization therapy.
Resynchronization therapy. Yes.
Well, CRT is a very interesting therapy which has made its place in our cardiac world from last about a decade. It is known as cardiac resynchronization therapy. As the word says, it resynchronizes the desynchronous heart. Once the patients have heart failure, I told you the heart function becomes low. These patients have their heart function so low that their lower chamber of the heart, instead of contracting in sync with each other, they are doing the rocking movement.
Okay.
So they have further deterioration of the symptoms. Their life is very miserable because of this synchronous movement being turned to a dissynchronous rocking movement. So we implant a therapy, device in these patients which is known as CRT. It is a kind of a pacemaker. It is a very interesting, sophisticated pacemaker and a very intelligent pacemaker which has 3 leads. Instead of conventional 2 leads, it has 3 leads. One lead goes into the right upper chamber of the heart, one lead goes into the right lower chamber of the heart, and the third lead goes to the left chamber of the heart. So this rocking movement of the lower chambers of the heart is converted into a sync movement whereby it improves the heart function of the patient and averts heart failure in such patients.
Okay. And what is the difference between heart failure and a heart attack?
Yeah.
People generally misunderstand what exactly is the difference. Even I don't know what's the difference between heart failure and heart attack.
See, heart attack is that when you have the arteries which are supplying blood to the heart, you have blockages in those arteries. Then patient has chest pain, sweating, and he suffers a heart attack. Okay, that is the plumbing action of the heart, right? Like when you make a house, you have a system of water supply and electrical supply, right? Both the systems are important. They are not dependent on each other. So heart also has 2 systems. One is the blood supply to the heart, that is the plumbing action. The other is the electrical network around the heart, which is the pulse. Okay. So when you have a choking of the plumbing system, that means the vessels, they develop some blockages and the blockage totally chokes the artery, that time you have a heart attack. And that heart attack leads on to the damage of the heart muscle. Once the heart muscle becomes poor, it becomes less than normal, then patient has heart failure.
Okay.
Because of that poor heart muscle functioning.
Okay. And what happens in a sudden cardiac arrest? How much chances of mortality is there?
In sudden cardiac arrest?
Yes.
Now, when you have, when I have told you about these blockages in the arteries causing heart attack, once that heart attack occurs, I told you that muscle is destroyed, that muscle is dead,
Okay.
right? If I have to explain it to you, you see, this is the heart, right? This is the vessel which is supplying blood to the heart. This is the vessel supplying blood to the heart, right? This is the muscle, okay? So this artery develops a blockage here, okay? This is like a tube. This is like a tube, and this tube gets choked by a clot inside.
Okay.
Right? This is a clot which forms inside the artery, and then the blood supply to this muscle is stopped because of this block.
Okay, because of this blockage.
Right.
Okay.
So once this blood supply stops to this muscle is damaged. This goes dead.
This goes dead.
Now this dead muscle is like a scar. Okay? It is like a scar. This dead muscle has no other use. It cannot contract normally. The contraction goes down, so patient has heart failure. But this dead muscle or scar, it becomes electrically charged.
Okay.
And it starts to throw some ectopics. These extra beats, once they come in succession, they increase this, because of this scar, they increase the heartbeat so much, it becomes like 200, 300 beats per minute, which normally should be 60 to 70, 80, up to 100 beats per minute. So heartbeat increases to 300 to 400 beats per minute and blood pressure drops. This is known as sudden cardiac arrest. You will see patients, you must have heard of patients, that a person slept nicely, रात का खाना खाया, आराम से सो गए, सुबह उठे ही नहीं.
Yes,
So
yes.
this is
yes.
what happens.
Okay, this is what happens.
Sudden cardiac
I've seen
arrest.
a lot of cases where
Yes.
the person has slept properly, had dinner, slept properly, but early morning
They never get up.
they never get up, and it is said that they had a sudden heart attack. That's what
That
it
is
said.
known as sudden cardiac arrest.
Cardiac arrest, that's called.
Right.
And it is also said that if a person has heart attack thrice, then the person has like 99% of chances to death. So
If you have one heart attack, you are damaging your muscle. If you have more than that, the risk always goes up. Even in the first heart attack, normally when you have a heart attack, you do not die. When you die after a heart attack, it is because of sudden cardiac arrest. Because your muscle is so poor and it is getting charged. So that term has to change. It is not because of heart attack, it is because of sudden cardiac arrest.
cardiac arrest. Okay.
And the probability of surviving from sudden cardiac arrest is nil.
Nil.
Yes. Until and unless you have taken some precautions in time.
So how can a person know that the person can have a sudden cardiac arrest?
Yes.
So,
That
so
is
what
a
the
very important
precautions can be
question.
taken?
Yes, that is a very important question. So whether you are up against sudden cardiac arrest or not, you need to show to a cardiologist or a cardiac electrophysiologist
Okay.
to risk stratify yourself. Okay. If you ever had a loss of consciousness in life,
Okay.
you ever had an episode of loss of consciousness, if you feel palpitations, if you're getting out of breath, if you already had a heart attack, you should go and see a cardiac electrophysiologist. We get a couple of very basic investigations done like ECG, echo, Holter, 24 hours Holter. These are very basic investigations which need to be done to stratify your risk of sudden cardiac arrest. And we can